For the treatment of depressive disorders, monoamine oxidase inhibitors, tricyclic antidepressants, selective monoamine reuptake inhibitors, these are atypical antidepressants, and NMDA receptor antagonists are 5 major classes of drugs that have been used. Monoamine oxidase inhibitors, also called MAO. Iproniazid is the first antidepressant drug that was first marketed as an antidepressant drug in 1957. It is a monoamine agonist. It increases the levels of monoamines, for example, norepinephrine and serotonin, by inhibiting the activity of monoamine oxidase, MAO, the enzyme that breaks down monoamine neurotransmitters in cytoplasm cellular fluid of the neuron. These MAO inhibitors have several side effects. The most dangerous is known as the cheese effect. Foods such as cheese, wine, and pickles contain amine called tyramine, which is a potent elevator of blood pressure. Normally, these foods have little effect on blood pressure because tyramine is rapidly metabolized in the liver by MAO. However, people who take MAO inhibitors and consume tyramine-rich foods run the risk of stroke caused by surges in blood pressure. That is the effect of cheese effect. Now, tricyclic antidepressants. These are named so because of their antidepressant action and because their chemical structures include 3 rings of atoms, alternative to MAO inhibitors. One example is imipramine, selective monoamine reuptake inhibitors. In the late 1980s, a new class of drugs, the selective serotonin reuptake inhibitors, was introduced for treating clinical depression. Selective serotonin reuptake inhibitors, SSRIs, are serotonin agonists that exert their agonistic effects by blocking the reuptake of serotonin from synapses. Fluoxetine, marketed as Prozac, was the first SSRI to be developed. Now there are many more such as paroxetine, sertraline, fluvoxamine, fluoxetine. Now the Prozac, its structure is a slight variation of that of imipramine and the other tricyclic antidepressants. In fact, it is no more effective than imipramine in treating depression. So it was immediately embraced by the community and has been prescribed in many million of cases. So the SSRIs has fewer side effects than tricyclics and MAO inhibitors, and they act against a wide range of psychological disorders in addition to depression. Now, the SSRIs were a success and it spawned the introduction of a similar class of drugs, selective norepinephrine reuptake inhibitors, SNRIs. These, for example, reboxetine, have proven to be just as effective as the SSRIs in the treatment of depression. Now, atypical antidepressants. These are the ones that did not fit in the 3 aforementioned classes, that are MAO inhibitors, tricyclic antidepressants, and selective monoamine reuptake inhibitors. Accordingly, a new class of antidepressant medications emerged that is really just a catch-all class comprising drugs that have many different modes of action. The atypical antidepressants. One of the drugs in this class is bupropion. It has several effects on neurotransmission. It is a blocker of dopamine and norepinephrine reuptake. It is also a blocker of nicotine acetylcholine receptors. Another example of a drug in this class is agomelatine, a melatonin receptor agonist. There are many other drugs in this class. NDMA receptor antagonist. Several studies reported a positive effect of antagonizing the glutamate NDMA receptor on depressive disorders. In early 2000s, and one agent in particular was shown to be remarkably effective, the dissociative hallucinogen ketamine. Remarkably, a single low dose of ketamine rapidly reduces depression, even in patients who had been experiencing severe episode. However, because ketamine has undesirable side effects, researchers are now in process of trying to identify more selective NDMA receptor antagonists and antagonists of other glutamate receptors with fewer side effects. Other than the drugs, there are some other ways to treat depression, one of which is brain stimulation to treat the depression. Two treatments involving brain stimulation have been developed for depression: repetitive transcranial magnetic stimulation and deep brain stimulation. First, repetitive transcranial magnetic stimulation, also called RTMS, where R is noted small and other letters are capital. It is a form of transcranial magnetic stimulation, that is TMS, that involves the non-invasive delivery of repetitive magnetic impulsive at either high frequencies, for example 5 pulses per second, or low frequencies, for example less than 1 pulse per second, to specific cortical areas, usually the prefrontal cortex. High frequency RTMS and low frequency RTMS are believed to stimulate and inhibit respectively activity within those brain regions to which they are applied. Meta-analyses have shown reliable improvement of depressive symptoms after either low frequency or high frequency RTMS when compared with sham RTMS. Sham RTMS is when it is like a placebo, where you are told that you are given the stimulator or inhibitor, but you are not given those frequency pulses. Second, deep brain stimulation. Chronic brain stimulation through an implanted electrode has been shown to have therapeutic effect in some depressed patients who have failed to respond to other treatments. Lozano and colleagues implanted the tip of a stimulation electrode in an area of white matter of the anterior cingulate gyrus in the medial prefrontal cortex. The stimulator, which was implanted under the skin, delivered continual pulses of electrical stimulation that could not be detected by the patients. The 20 patients in this study were selected because they had repeatedly failed to respond to conventional treatments. Considering that the patients had failed to respond to other treatments, the results were strikingly positive. 60% showed substantial improvements, 35% were largely symptom-free, and most of the patients were improved for at least 1 year, the duration of the study. These positive results have been replicated at other treatment centers.